Hello and welcome to the Be Formless Flow-Driven VC podcast, where we are reshaping life, leadership and investing. And today I am welcoming Dr. John Shufeldt. Welcome to the show, John.
It's a pleasure to be here. Thank you.
Oh, thank you. I know you've got a fair bit going on behind the scenes, John. So I'm really privileged and grateful that you have taken the time to talk with me. It's your afternoon, my morning, my Saturday, your Friday afternoon. So thank you for being here with me, because you have
Pleasure.
quite a story.
Pleasure.
Let's get into it, John. I'm going to start with, you have multiple roles. You're a multiple entrepreneur, and you are also a practicing emergency medicine physician. So in the emergency department, medicine physician, part-time. And then on top of that, you're a venture capitalist focusing on early stage health and med tech, leading expert in medical entrepreneurship. You're 11 times author, founder, CEO of Tribal Health, MEMD, and NextCare. And it's pretty crazy to think, how do you fit all of this in to your life? You're also a father. You've got a lot happening, and so let's get into it, because you've got quite the journey and the story. So as I said, John is a physician, multi-asset healthcare founder, investor, and venture builder focused on improving access, quality, and efficiency in care delivery. You pioneered urgent care with NextCare, scaled it from one clinic to 60 locations across 6 states. Later, you co-founded MEMD before its acquisition by Walmart in 2021. That would have been quite the story and quite the acquisition. And founded Tribal Health, which now serves Native American communities across the US. You also lead, and you've got your T-shirt on, John. Put your branding up. You got to promote your brand. Xcellerant Ventures, which is a health tech venture firm investing in early stage companies at the intersection of healthcare and emerging technology. And it supports broader access to innovation through the Jetstream Venture Fund. Oh my gosh, I'm getting all my words muddled up this morning, aren't I? And I can tell you're a big fan of planes, everything.
Yes.
We talked last time about rockets as well. I don't know why we talked, Jetstream rockets. Yeah. In October 2025, Arizona State University announced a 9-figure gift from John that renamed its new medical school the John Shufeldt School of Medicine and Medical Engineering. What a way to give back, John. That's a beautiful gift.
Thank you.
You're a physician with an entrepreneurial lens, and your work sits where medicine, innovation, and leadership meet. Your through the line is clear: build what improves lives, back what scales care, and stay grounded enough to keep learning while doing it. Your own mantra says, eat well, stay hungry, stay humble. Tell us a bit about your journey, because you have quite the journey. And I also want to know, from the very start of this story, how do you juggle it all? How do you manage it all?
I mean, practicing emergency medicine, it's very shift-based work. And I was often the one in control, usually you're in the control of your own schedule. So, when I was going back to school, I would work, more nights and more weekends. When I was starting businesses, I would schedule my shifts in the emergency department around my business opportunities. With Tribal Health, I was always a physician of last resort, meaning that because I could jump in the plane or helicopter and fly there to cover shifts on short notice. And so, there are a lot of holidays and weekends where I, get up at 3, jump in the plane at 4, fly to the reservation for, it would, take a couple hours, and then work for 12 hours and fly back. So it was a lot of fun.
Yeah. And so then tell us about your entrepreneurial journey and what brought you to being an entrepreneur.
I have a fatal flaw of, when I see something, I always think, well, I'm not the sharpest tack in the room. And so, or in the box. So there you go. So someone else must have already seen this. And then if I look into it and they haven't, then okay, well, it must be a dumb idea. Or if it's not a dumb idea, maybe it's too hard to solve. Maybe the problem's too difficult to solve. But then there are a lot of times when I just say, well, I'm going to be the one to solve it or try to solve it. And, I've done that a few times, and it's worked a few and it's failed a lot, but it's been fun. So, back in the urgent care days, there weren't really any urgent cares around. It wasn't a thing in 1993. And so we started that, and, I did it for 17 years. And then 2 weeks later, when I was out of that, I started the virtual healthcare in 2010. And again, very, very few virtual providers I think there may have been one other one in the world at the time. And then when COVID hit, of course, it went like this, but that
Yeah.
was the inflection point.
Yeah. Wow. Incredible. And then, like, when you talk, you mentioned you've had quite a lot of failures. How do you define failure, and what does it look like for you?
Well, I think if there's a secret sauce that I have, I grew up failing. I mean, I was a borderline at best student. I was a borderline at best athlete. And so failure it came easy to me. And so it didn't bother me because I'd done it so often. And so, a lot of people fear failure. I never did. And so, the companies that I've started, a lot of companies were they were ahead of their time, or they were a dumb idea and no one else thought it was a good idea. And so I had a lot of those that we did them for a while and never got a lot of steam, and maybe they made a little bit of money or lost a little bit or a lot of money, and then it would shut them down and I'd go on to the next thing.
I'm always fascinated in being ahead of your time in terms of, because I think, like, I always say I've got doctor handwriting. I don't know if you, like, from a doctor's perspective, it's really messy. It's like,
Yeah, mine too.
and I always say I've got doctor's handwriting because I'm always thinking about ideas and things, and like a doctor, I don't know why I made that up myself, right? And it's like, and so my question to you is, when I think about being ahead of time, I do that a lot in terms of I'll have a lot of ideas and the market's not ready for it. And then, so I guess my question to you is one, as an entrepreneur, and two, from a VC perspective, when do you know that, all right, you're going to have to park this one because it is, it's ahead of time and it's going to take too long for people to catch up? And versus, when do you stick at it because of sheer belief that that in time, and if you make some tweaks to it, that people will catch up with it? Like, you clearly just walked away when you'd been ahead of time, but and have you had situations where you've stayed true to it?
Well, so I mean, so me and the virtual medicine business it took about 10 years before it really caught on. And so, I mean, I think, had I been a little smarter, I might have walked away, but it's just one of those things where I pivoted a couple times and then slowly grew the business. Urgent care was the same way for about 7 years. It really did not take off well. But there's other things that I did. One was called Healthy Bid, and it was a reverse auction. So if you needed your gallbladder out, you could put it up on the site, and surgery centers, the places would have outpatient surgery, would bid on it and say, well, we'll take your gallbladder out. And you'd say, I want a board certified surgeon. I want it to be 25 miles. I want it to be on a Tuesday, whatever. And they would bid on it and say, well, we can take your gallbladder out for $5,000 or whatever the price was, because from their perspective, they knew that on Tuesday mornings, they always are pretty under resourced,
Yeah.
or overstaffed, I should say. So they would do it at cost. And it just never took off. In my mind, it made a tremendous amount of sense for people that didn't have insurance or people that had high deductibles. I just couldn't get patients were interested, but I couldn't get the providers to do it. And subsequently, I've heard other people have tried to do it as well. I don't know if any of them were successful, but it's things that, again, it makes sense to me, which is not always the best barometer.
Yeah, it's like, it's quite often we get caught up in our, like, we think it's amazing, right?
Yeah.
And then, other people, don't necessarily catch on as much as we do. You were just talking about MD, and then it was acquired by Walmart in 2021. What was that like for you? Because Walmart is, like, huge. It's a huge
Yeah,
retailer.
it was a 9,000 pound gorilla versus the little ant. And so their diligence process was very thorough. It was 6 months, and they looked under every rock. And I, talked to their CEO on a Zoom call, and, he vetted me, and they went deep into the business, but they could not have been more professional. And I mean, they were absolutely great to work with, but they were very, very objective. And I think there was one or two other telemedicine companies that looked up before us that failed along the way. And so they were just very black and white about it. And unfortunately, it worked out. And then most of the company went to work for Walmart for 2 to 3 years after that. So they went on to become Walmart employees. I was a consultant for a year, and then I had a 1 year obligation, and then
Oh gosh, what was that like for you having in the 1 year obligation? Like, I mean, we did a 6 year earnout. It was wild. Like, it was so long. It was just,
It was a lot of fun because the people that Walmart had, I mean, they were really good people. I mean, to a person, they were sharp and well-meaning and well thought, and they were thoughtful. But it was such a big organization; it was hard to get any change,
yeah,
any effective change accomplished. And the folks that stayed were kind of frustrated because they're used to moving and quickly and turning on a dime and changing. And Walmart was just very. I mean, it's a huge organization. They were just very focused to go, go slow, not make changes quickly, and it was steering the battleship sort of changes.
yeah,
But
yeah.
yeah, it was a lot of fun.
And then today you now lead Xcellerant Ventures. Tell us a little bit about Xcellerant Ventures, which is obviously health tech. What are you seeing from, like, you clearly are, a pioneer of, frontier and leading edge, you're ahead of your time a lot of the time. What are you seeing in terms of the early stage companies, these healthcare and emerging technology? Yeah, what are you seeing?
Right.
What interests you?
So, I mean, that was our first fund. We did pretty much all health tech, med tech, a lot of SaaS model businesses. Our second fund is called Jetstream. So you don't need to be accredited or a qualified investor. You can invest as little as $5,000 and you can get your money out. So it's very atypical of typical venture capital. We invested in SpaceX and we invested in Carbogenesis. We invested in some non-health tech companies, but we also look at a lot of health tech. Where healthcare is going and where it needs to go is that I believe it needs to be highly personalized, on demand, where you're seeing the right provider at the right time for the right price. And so when you need something, there is a portal you can go into, put in your symptoms, put in your questions, your symptoms, what have you. And there's an AI direction that goes to, and maybe you go right to a physician or maybe an ambulance is called. But when you log in, we know you've already sequenced your genome. We know what meds you can and can't take. We know what your pharmacy is. We know what your health plan and what your deductible is. And we steer you to the right patient, the right provider at the right time. I mean, that's in my mind where healthcare, at least in the US, needs to go. And it makes sense. It'll be a big lift, but it makes a lot of sense, at least to me.
Yeah, I agree. And it's also for me, really like longevity, proactive health, the ability to, like you said, the personalization, because, I think about AI and obviously it's, like we still need the human in so many aspects, and AI can only do so much. And, I guess for me, it's really important that you feel like you're being heard and you're being listened to. And, everyone's got their things, and the last thing you want happening to you is not feeling like you're being heard, and that you're just getting pushed through and passed through when actually
Right.
you genuinely know when something's wrong.
Right. And the way I want to use AI and the way I've used AI is not to take the doctor and the patient, not to separate the physician, the patient, but to take some of the workload off the physician so they can spend more time with the patients.
Yeah,
And that to me is crucial. So, we spend so much of our time with our head in the computers, putting things in the medical record and organizing all this stuff and billing. And it's, we probably spend 75% of our time on the computer and 15% of our time with the patient and 10% of our time juggling. And so that's ridiculous. I mean, we should be spending the majority of our time with the patient and having this sort of interaction where you feel like you're being heard and I feel like I really understand you and get to know you, because that way I can help you we can make the best choice together.
yeah, it's so
I
true.
mean,
I mean,
that's where it
yeah,
needs to go.
yeah, because every time you go to the doctor, they're on their computer, they're talking to you, but they're
Oh yeah,
writing notes, they're talking to you, they're looking at, like, it's quite it's you've just raised a point. It's quite distracting, right? Like, in terms of, like,
it is.
we're not
So I've
fully
used,
present.
yeah, yes, and I don't like that. So I use scribes, and we use AI scribes that listen to the discussion and then will enter stuff in the medical record. Because when you go to, provider, a lot of times it's for something very benign, but sometimes it's for something pretty serious.
Yeah,
And, you want it to be like this. You want
yeah,
to have this discussion.
yeah.
You don't want somebody to be focused on something else.
No, totally. So tell me, so Jetstream Venture Fund, is that is that the only focus, or what else are you focusing on within the fund at the moment?
So Jetstream Venture Fund is, we're raising money for the new fund. Our intent is to make small bets that we de-risk And a lot of companies every year, maybe 30 to 40 companies every year, making these $250,000 to $500,000 bets on them. And bets is a wrong word because we really try to de-risk these companies and then also give them fractional executives to help them if they have any challenges. So if they don't have a CFO, they don't have a chief marketing officer, what have you, we provide them for them, and we don't get anything for it, but they pay the person directly. So I spent a lot of time on that, and then we also have met a company called VivaMed Biopharma, which does early stage drug development and also repurposed drug development using an AI model to find drugs for new disease. Basically, looking at all the diseases in the world, all the molecules in the world, and then the biomarkers, and trying to find new medications for specific biomarkers for specific diseases. So
Right.
with that's up and running.
Amazing, amazing. And do you, in terms of like you gifted the Arizona State University a nine-figure gift.
Right.
Was that part of why, like, was that part of the Jetstream Venture Fund, or was it completely separate?
It's completely separate. That was just, I mean, for me, that was invested in the future in Arizona's healthcare and the world's healthcare because ASU is a huge university. They're in multiple countries around the world. And I know this medical school, and this isn't because of me, but I know this medical school will really move the needle on how we treat patients. They're dual degreed engineers and physicians. And so they're going to be taught very systems level thinking on improving processes and designing new treatments and new devices and new medications.
Incredible, incredible. Just the fact that you were able to even give a gift like that. You know, you listening to you, you're very, very humble, and you're very, very much, your number one priority is care. Like, like I'm not assuming, I guess I'm just kind of listening to you, and I think about care in personal care and patients, etc. In terms of coming right back into Jetstream Venture Fund and early stage investing, etc., you obviously provide the fractional executives. Like, in terms of the care required for these founders, which, because quite often as an entrepreneur you can be quite fragile, right? Your mental state,
Yeah.
fragility of if the business is going to succeed or not. How much is that similar to, for example, looking after a patient versus like caring for a founder? Do you know what I'm saying? Like, do you see similarities there?
Yeah, it's a really great question, actually, and no one's ever asked me that before. But I see a ton of similarities in it. And with both patients and founders, sometimes you have to have a little bit of tough love. And so I've had discussions with patients and say, look, the reason you're here is because XYZ. You drank too much, you're on drugs you shouldn't be on, you're driving without a seatbelt, you're on a bicycle without a helmet. I get it, but if you don't want to have this happen to you again, that has to change. But it's up to you. But it has to change. I'm happy to see you, period. But if you really want to preserve your health and your longevity, that's got to change. And same with founders. Look, I've already made every mistake in the book, and we have a whole group of people here to help you not be as dumb as I was when I was in your shoes. So if you're willing to listen, we're in. If you're not willing to listen, that's okay, but we're probably not going to invest in you. And if we already did, we're probably not going to invest in you again. But it's going to be your choice. And, it's all free will. And just because it's my opinion doesn't mean it's the right opinion, but I want people to at least say, okay, let me consider that. And there's some validity behind it. And if there's not, say, look, I've considered it and I don't think that's correct. Here's why. And God knows I could learn stuff too. So it should be that sort of dialogue. And
Yeah,
that's what we look for in founders, to have that open communication that's just blunt and direct, but also kind.
yeah, I like that. Blunt, direct, and kind. It's really important. Over the years, do you think the founder has genuinely changed, or do you think there's still the same? Every founder is like same similarities. Like, I guess where I'm going with this is, tech is revolutionizing the way we're doing things, especially like, I mean, there was always internet, the mobile phone, etc. Then now we've got this next wave, which is AI.
Right.
You talk about dumber. You use this language, dumber. And, I've been reading a lot lately around, we need to be careful because AI can make us dumber. There's still a real role for humans in this. Are you seeing potentially, I don't want it to come across as derogatory, but And are you seeing, that some founders aren't using their critical problem solving, their human potential, and relying too much on the tech? Are you calling that out as well?
We try to, and I think it's probably a little early for that for some, but I'll get emails, and we have somebody that works for us who is every time he responds to me, I'm like, okay, was this AI or is this really him responding to me? I heard NVIDIA's CEO interviewed, and when he talked about the barometer before was just brain power. Can you code? Do you have the brain power? And he said, really, he thinks the new metric is going to be, can you interact? What's your ability to have meaningful discussions, conversations with people? And that's to be the new barometer. It won't be just pure brain power, because really AI will make everybody brilliant
Yeah.
by the current standards. So now can you take what you know, take what you've learned, and communicate it to others in a way that can, allows them to open their eyes and to change? Can you lead from the front? And that's what we kind of look for. I always say, what I've invested in Steve Jobs, who shows up late in sandals, without a shower, or Mark Zuckerberg shows up in pajama bottoms at Sequoia late. And the answer is probably I probably wouldn't have, and that would have been a mistake, because clearly they're both revolutionary. But we look for founders that it's this weird metric. We want them. It's a quote about the unreasonable person. All change depends on the unreasonable person, because a reasonable person just goes along with it. But then can you interact with the unreasonable person, or are they so unreasonable they're not willing to listen to anything? And we try to find that balance between unreasonableness and ability to communicate.
Yeah, it's so true. I think about, the patterns that AI is able to find that we sometimes can't find. You're like, how did that even come about? And then it's really, for me, that comes back to pulling out the meaning of, well, what does that pattern actually mean? And then how do you
Right.
then articulate it? How do you bring that to life with from a human aspect? I think it is really important. What are you seeing then also from a total VC ecosystem perspective in terms of, is that reshaping and changing? Like, are you seeing it shifting for the better, or what are you observing and seeing there?
Well, I think anytime there's a kind of an existential change, think of, the late 90s with the internet, think of the printing press, Gutenberg's printing press. Anytime there's these large sea shifts, sea changes and change, there's good and bad. And I think we're going to see that. And, in 2000, there was the internet boom, and then the bust, and everything collapsed. We'll probably see a little bit of a collapse here with some of the AI companies, because it's become so democratized now that even I, who was not trained as a computer scientist or an engineer, even I can code, because I can put in what I want to and write a
Yeah.
Python script for it. Never thought I could do that before. And
No.
so I think it'll really democratize intelligence. So then the question is, who comes up with the ideas that I always think are non-consensus but right? In other words, they're kind of radical. Like Airbnb is an example I use. I mean, no one thought anybody would be comfortable sleeping on an air mattress in someone's house.
No.
And it obviously morphed, but that was the start of Airbnb.
Yeah.
And people at the time were like, well, that's crazy. So it was very non-consensus, but as it turns out, it was right. It
Mm,
morphed a little bit, but not a lot, into this now global business.
mm.
We've all used Airbnb, I'm sure.
Yeah. It's fascinating. Yesterday I received an email from OpenAI, and I'm on the business plan, and obviously Claude is, going full tilt at the moment, and there's lots of conversations around, good power versus bad power, and you only have to look at the world and the state of play and everything that's happening. And I truly believe that good power is coming. It's going to take over the world. Call me someone who has a big dream, and I really do think so. What I thought was interesting yesterday was that they've started to discount, and so they're discounting on the business plan, and they're crediting back. They're giving you money back. And I went, oh, that's super interesting in terms of just what you're talking about. We're probably going to see a collapse of some sort at some point. I think there's a lot of shiny stuff out there. I'm not suggesting OpenAI is going to collapse at all. I just thought it was really interesting that they're now, they were charging what they were charging, and you're now starting to see a reduction in pricing
Right.
based on the threats of other businesses or other companies coming in that are clearly stealing,
Competitors.
competitors.
Yeah.
Yeah.
Yeah. It will be it will be a lot of fun, and it's funny, I'm glad I'm the age I'm at because I think now if you were a very bright student in college or high school, it'd be really difficult. You know, I always call it the curse of competence. It'd be really difficult to figure out what you wanted to do. I was just always dead set on being a physician.
Mm.
But I know a lot of really bright kids who are like, I could do all sorts of things and I don't know what to do because I don't want to be replaced by AI someday. I mean, a lot of medicine's going to be replaced by AI. Radiologists will be replaced. Pathologists will probably be replaced. They'll oversee more, but there'll be
Yeah.
less need for them. And so
Yeah.
it'd be tough to be, the 18-year-old right now thinking, gosh, what's my life going to look like? Because I want to be able to think ahead and do something that's not going to be replaceable.
So just on that, what would be your advice? I mean, you've got children yourself, young adult children or adult children.
So
What would
they're in the 30s, mid 30s, and so they're a little past it. But I think my advice would be find something that you're uniquely good at, that you feel like it's something that you uniquely could do, and work hard to expand your skills and your knowledge set
mm,
and pursue that. I mean, if you want to be a teacher and you love that interaction with students, by all means be a teacher. But also figure out what makes you so unique and different in your ability to do that and really work on those skills.
yeah, it's so true, isn't it, John? And what's
Yeah.
next for you? What's next for you, John? Like you've conquered the world. Look at everything you've achieved, and you're still going. Like it doesn't sound like you're slowing down in any way, shape, or
No.
form. What's next for you?
So I'll definitely be very involved with the medical school, and I'll teach students and teach classes and have that interaction, which I'm really excited about. Viva Med, we're working on bringing a lot of drugs to market. We're raising money for Jetstream or the Jetstream Fund. And then I've written a screenplay that I'm really trying to move the needle on that. And so I'm looking, I want to get that in some production company and bring that to life.
What's the screenplay about? Or you can't say.
Oh, I could say it's about an emergency medicine physician who hangs himself
Oh,
and gets resuscitated and comes back very empathic. He kind of he gets burned out over the years. He finally gets too numb to do anymore. He loses basically his family life, and he just gives up. And so he has a patient die who's a young girl, reminds him of his own daughter, and he just calls it a day. But he gets resuscitated, and he's half Native American. So he comes back and he's in the psych ward and he befriends a teenage Native American kid who tries to commit suicide also, and he saves him. And they become close. So basically he goes back to the reservation where his mom came. He never met his mom, but where his mom came from to work in the emergency departments up on the reservation. It's called Empathy.
wow.
The novella's done, the book is done, and the first couple episodes of the screenplay I've written. But now I need to get somebody who actually knows what they're doing to help me on the rest of it. I
Oh my
want to hire
God,
a Native American
incredible.
author.
Incredible.
It should be fun. I'm excited about it. I've literally worked on it for 25 years.
Yeah, it sounds incredible. What a great, watch out. What are all the other shows that have the series over the years, like ER and
Oh yeah, yeah. I grew up watching ER.
oh
I
my
was a
gosh, that
set
is
doctor on a movie with George Clooney, so I got to meet him and got to know him a little bit. He's a wonderful guy.
incredible.
And the pitch really done a lot to raise the bar for how these medical dramas look, because they've done a phenomenal job.
Yeah, incredible. Oh my gosh, John, you're incredible. Yeah, I'm really grateful that we've had a conversation today.
Thank you.
John, how do we find out more about you? How do we find out more about Jetstream,
So
Xcellerant?
yeah, it's just XcellerantVentures.com, and it's spelled with an X, so it's XCEL, Xcellerant Ventures, and then Viva Med Biopharma.
Amazing. And all your
So
books, you've got 11 books.
I
Is
do.
there, of the 11, final question for you, what would be your top recommendation to share with the audience if they wanted to read something of one of your books?
I mean, there's a book on physician entrepreneurship, but it's really for physicians who want to start businesses. My very first one, and the one I liked the best, was called Ingredients of Outliers, because I looked at the characteristics of people I admired and the characteristics that I wanted to further develop in myself
Mm,
by trying to emulate them. So I'd write about the person in the book. I pick the quality, and then write about the person in the book. Generally, write about my failures and my lack of qualities in the book, and then what I was doing to try to emulate them. So it's called Ingredients of Outliers. It's finding people who are outliers and saying, "Wow, that person is really X. I want to be I want to have
Yeah,
that
I love
same
that.
quality. What can I do?
I
So it's
love
really
that.
a fun book. It's called Ingredients About Layers.
And is that on Amazon? Where can we get
It
that one
is.
from?
It
Yeah,
is.
I'm gonna get it myself. John, thank you so much for your time. I know that, like I said, I know you've got a bit going on, so thank you, and I appreciate you.
My pleasure, B. Thank
And
you.
wishing you a happy Easter is what I'll say.
Thank you. And to you.
Thank you, John.